this evening.
Good evening. Thank you for having me.
Yeah. So I would like to give a brief introduction. In general, in dental and oral health is an essential part of overall health and well-being. But according to a report by NABH, that is National for Biotechnology Information, 50% of school-going children in India suffer of cavities. And also, we have 90% of the adult population which is affected by periodontal issues, so that gum infections. So the dental health problem is there in urban and in the rural areas, but it is largely ignored always. So there are many private entities which are balancing this in the private healthcare, but I think Clove Dental is doing something special, initiated by you in 2011 in Delhi. So you are trying to bridge in the gap between the urban as well as in the rural areas, and I hope you have more than 350 dental clinics across 25 cities in India right now, right?
Correct.
So if you could just insist upon the oral health scenario in India, how it is in general to start off with, then maybe we will go on, carry on with more detailed information on what Clove Dental is doing and about the pandemic and everything. Yeah.
Sure. Thank you, Padma. So
Yeah.
I think, as you mentioned already, in India we have a serious oral health issue. I think that's probably true for most of the world, by the way, because our oral cavity is something that uh, everything we eat, we drink, we breathe, is done through that oral cavity. So when you are using that cavity so often, it is only natural that you're going to find infections or bacteria that will linger on. And oftentimes people, maybe 20 years ago we probably were not even brushing as a country as much, but today we are definitely much more aware about brushing. But brushing alone isn't solving the problem, because the bacteria is small, the viruses are small, they stick in between. So this issue is a serious problem. 30% of, I think, cancers in India are oral cancers. We also have an oral cancer issue because a lot of people are smoking, eating gutka. We're drinking coffee, we're drinking tea. So these are all things. We're smoking. There are a lot of things these things that impact our oral health. So oral health is a serious issue. You've given the numbers. Nearly 90% of the Indian population has an oral disease. The challenge is that people often are waiting for the pain to occur. They believe that if pain occurs, then I'll look after it. And I think when the pain is happening, you've probably gone too far, because you could have fixed it. And then the second concern people often have is that dental treatments tend to be, it cost money, because people don't have insurances around this. The reality is that dental treatments actually don't cost a lot if you are looking after your teeth regular basis. But if you ignore the problem, let the infection spread into your jaw, into your lower jaw, inside your gums, then clearly you'll require a lot more intricate, a lot more minute treatment in a very small surface of your body. So it will require an excessive amount of skill, which will then obviously invite some cost to it. So my advice to all of our citizens is, please look after your teeth. I mean, they are the gateway to your health. This is a gateway to everything you do in your body, and this is a serious issue. Now, what we've done at Clove, just to answer your second part of the question, is that we have decided that in 2011 to launch a professional corporatized dental group that goes out and builds high quality clinics that delivers high quality dental treatments at very affordable prices to our patients. So that's what we've been doing, and with the blessings of Almighty, and of course the blessings of all our patients, we have grown. Today we have, as you mentioned, 350 clinics in 25 cities, and we have over 900 dentists who are working full-time for us. We also made a decision to bring on dentists as full-time doctors, because we wanted to remove any wrong incentive that they would have around getting paid if you paid. So they're on salaries. They have some incentives to identify high performers, because we always need to reward the folks who are performing better. But most of their salary is fixed, so that they look after patients' care rather than worrying about their financials. So let me stop here for that question. I can't hear you. Yeah. Sorry.
Yeah. So I wanted to get on to the next point where, the whole, globally we are reeling under a very difficult phase, and, particularly in healthcare, and dentistry has taken a massive hit, I would say, because amid the COVID-19 pandemic, due to the very nature of the work, the close proximity with the patients, the dentist should have the frequent exposure to the saliva, the bloodstream. So, how the 6 months have been? It must have been difficult. What challenges have COVID posed on the company, and how is the situation? In the first from the March. If you could just tell me right now, it should be better, but if you could.
Sure. So it's a very loaded question, and I hope I'll take a few minutes if you bear with me. So in March, on 19th of March, actually, a few hours before, Prime Minister Modi came on to announce the first Janta curfew, if you recall. We as a management group were sitting in our office in Delhi, and we were looking at the information coming in from different parts of the country, and we made a decision that our patient safety and, more importantly, our doctor safety and our staff safety is very critical for us, because we are in a healthcare business. So if we can't have our healthy staff members, how can we have healthy patients? So we made a decision, and we on 20th of March, we closed all our 350 clinics overnight. We, of course, temporarily, we shut them down till the time the crisis, we knew what this crisis was all about. And that decision, I think, in hindsight, was one of the most important, critical, and the right decision. There's a little bit of an echo in this. Is that
Yeah.
just me? Maybe you want
Yeah.
to mute yourself. Yeah, that's better. Okay. So then on 20th, we closed all our clinics. And then, of course, it took us a few days just to understand what happened. What is this all? Because this thing came, even though the world knew about it, but I think it came to India pretty quickly and pretty suddenly. So, but then we realized that we are dealing with oral cavity, and this is an oral respiratory virus. The good news for us is that dentists are perhaps the most intimate and qualified about the oral cavity because of their profession. So dentists as professions are worry about viruses and bacteria more than perhaps any other medical doctor, maybe surgeons in an operating theater, but certainly our dentists are very familiar with how do you handle viruses, how do you handle bacteria, because COVID is not the only virus in town. I mean, yes, it is a nasty one, but there are many other viruses around. So our doctors have been dealing with viruses and bacteria all their professional life. So the good news was that we were starting on a very high level of knowledge of bacteria and virus compared to any other organization, healthcare, non-healthcare institution. So that meant that we started at a pretty high footing, and then we assigned many of our 900 doctors and said, why don't we begin a week or 10 days of extensive research to understand exactly what this virus is all about and how are we going to combat it. So we, instead of sitting there and sulking and figuring out what happened, our doctors immediately focused and we formed a committee and we started to do some research. We explored what was happening in Australia, China, US, UK, and you name it. And we got all that information. And within about 10, 15 days after the closure, we were prepared. We knew exactly what we need to do to combat this and to survive in this crisis as doctors. Now, of course, that meant we knew the information, but we had to convert it into practicality and make it sure that we had our clinics were ready. So the very first thing we did was we introduced what we call 10x safety at Clove Dental. So we took our safety protocols that we had already implemented before, many of them, because I said, we are safety conscious, and safety has always been our priority. And we have now turned it into an obsession, by the way, but safety always been our priority. And we then took those safety protocols, we added some new safety protocols, and we introduced 10x safety at Clove Dental. And those protocols were then, we spent the next pretty much the whole month of April educating all our remaining 900 doctors and getting them all on the same page in terms of knowledge. What is this virus? How do you combat it? What is the relationship with the oral cavity? How can you operate? How can you perform treatments without cross contamination, and we spent in about a month of April doing both research, refining requirements, and training our doctors. The end result was that by the time the lockdowns were starting to lift off, we were well prepared. Our doctors were well prepared, and then we also, identified, our doctors identified two pieces of new equipment that we wanted to add into our clinics that will ensure that any virus that is in the clinic will be extracted. So let me talk about those two equipment quickly. One is called aerosol suction and decontamination unit, ASDU. This aerosol suction and decontamination unit is a device that has a little cup which is about the size of maybe a small CD, if some of you remember CDs, and you put it about 8 or 9 inches away from your mouth, and it has an exhaust similar to the exhaust that you might have in your kitchen above your cooking range. That exhaust fan that sucks all the virus that is coming out, all the aerosols that are coming in your mouth. Now remember, in a clinic, only mouth that is open is a patient's mouth, because doctors are covered with PPE, they have shields, they have glasses, our staff are covered. So we have all those protocols that everybody else has, of course. But the only mouth that is open is a patient's mouth. Now, how do you make sure that any aerosols that patient has generated are taken away from the environment and extracted into this unit? So we bought this equipment. Each of our clinics now has this equipment. It sucks away all the aerosols, puts it into a decontamination unit. It filters this through HEPA filters and UV light, which is known to kill the viruses. And then it releases a fresh decontaminated air out of the other end. So that device was deployed, and we're the first ones in the country to have acquired that equipment and brought it in from overseas and deployed it in our clinics. The second piece of equipment is what we call constant fumigation device, CFD. The idea there is that if there is any, naughty little aerosols, I like to call them, that escape this aerosol, that ASDU unit, the constant fumigation that is going on in the clinic will kill those as well. So the idea is that this way we are ensuring that there is no errant bacteria or virus in the atmosphere of the clinic. Now, by doing so, by talking about safety protocols, of course, we do the PPE and temperature check and patient profile in terms of travel history and all those things that other people do. We are doing all of that. But by adding these two pieces of equipment and arming our doctors with the knowledge, which, remember, they already were at a pretty high level of viral and bacterial knowledge, we were able to provide an environment where our doctors and our staff felt 100% safe. Now, I want to make a point here. Our focus was get our doctors and our staff safe. If they feel and they are safe, and they are the experts, by the way, in this virus, so, and all viruses, if they feel safe and they feel secure, they will be happy and confident, and they'll go back to the clinics, and therefore they will pass on that confidence to our patients as well. So patients' psychology, doctor psychology is as important as the environment that you're in, because patient is walking in saying, I don't know, this is an oral cavity. Should I go into a dentist or not? By doing all the things I just mentioned, we were able to provide full confidence to our doctors and full confidence to our patients. As a result of all this, today, we have about 220 of our clinics are open. Another 80 are opening next week. So we'll have about 300 of our clinics that have opened across the country. And we'll probably open the rest in the coming weeks. The only reason it takes us a while, of course, to open is, new equipment has to be ordered, new protocols have to come in. So opening 300 clinics, 350 clinics, it is a slow process, because you can't do them overnight if you want to do it right. So that's how we have been managing and surviving in this crisis so far.
Very well said, and I think you have taken a lot of effort. Yeah. Now you've touched upon how Clove is ensuring patient and clinical safety during the lockdown. What has been the biggest challenge while procuring the equipments, coming and putting it into all the clinics, or what are the kind of challenges you faced in the past few months? If you could just update
Sure.
us on that.
As I mentioned, on March 19th, we closed all our clinics. So what that meant from a business perspective, I'll talk about business for a second. From a business perspective, that meant that all our revenue went away. But our cost was still there. We have rental costs. We have 350 units that we are paying rent on, that cost. We have 2,000 employees, the salaries of those employees. We have materials that we're buying, vendors and partners we work with. We have utilities we are paying. So there is a whole lot of cost that's in a company of our size that exists. But if the revenue goes to zero, suddenly that cost becomes a significant challenge for you. We then made a decision that we are not going to do any layoffs or any terminations, because we made a decision that this is not our doctor's fault or our employees' fault or our business's fault. This is, as I call it, the wrath of the Almighty, right? So therefore, we are not going to penalize to the extent we can afford it. We're not going to penalize our staff for it. So instead of sending a few employees home or terminating some employees and then moving the rest of the employees at 70, 80% of their salaries, we said, you know what, we're one family. We're going to collectively endure this crisis. We're going to do it together. So we went and retained all our employees and continued to pay them less salary. Sustenance allowance is what we called it, but we kept everybody employed. And it was not until August 1st that we sent some people on long leaves for the first time, because the crisis just kept on going and going. But then we are recalling most of them back. So some of our staff have taken since March, maybe a few weeks of unpaid leave. Beyond that, maybe a few hundred people. But beyond that, most of our 2,000 employees have continued to be employed, continue to be on payrolls, and that's how we have endured. And that has built and that I think is a testament to by the way, this suggestion wasn't from me. This suggestion was from our team. And I also want to point out that some of our, the top half of our company then took part of their salary in March and April and created an employee endowment relief fund so that we could look after some of those employees who were in critical need, who had family issues, that we could support them. We also went ahead and increased the health insurance value, the limit of the health insurance for all our employees during this period. So the idea was that if you look after your people, because for us as a healthcare services company, what do we offer? We offer dental treatments. How do we offer dental treatments? Through our doctors, through our staff. So our staff, our doctors is the company. We are a dentist company, and dentist is our product. It's our service. So therefore, you have to look after your product, your service, and our product and our service is our doctors. I don't mean to, call them products, but I'm trying to compare them to a typical product company. A typical product company would look after their products. If you have a problem, if you have an iPhone company, you're going to go hold to the warehouse and make sure your iPhones are secure, because that's your product, right? You want to make sure, because the customers will like your iPhone. So for us, our product, our resource, our asset is our doctors, and our staff. Therefore, our focus was very clear. Look after our staff, make sure that we can endure this together. And I think that is the reason why our staff has come back, and many of them are saying, listen, we are willing to work and endure this crisis. You don't even have to pay us full salaries. We will work on less than full salaries even after we have come back. And that is a testament of the Clove culture and the Clove family. And I'm so proud of it, by the way. So
yeah, very good. Yeah. To go on, I would like to ask you, do you think there was a delay in the release of guidelines for the dentistry professionals when the lockdown had happened? And if you could tell me, it should have been, even more earlier should have been done. And I have one more question to this, extended question. Is there a need to evaluate the Dentist Act 1948? Because this is a correct time where you can, sound it off to the policy makers. You think that, regulations and dental education profession of dentistry in India needs to relook the act?
All right, those are good questions. So first, I think first part of your question is, was there a delay from the Dental Council? I would say no, right? I think, everybody was taken aback with this, sudden crisis. Now, we have to understand our dental councils across the different states. Each state has a dental council. Then we have a central body as well. The members of those council are typically individual dental practitioners. So they are practicing their clinics and running their clinics. So therefore they were facing this problem like anybody else, and they were also trying to figure out how to handle with it. Now the advantage that we had as a company is that we have a group of 900 doctors. So you could get 10 people to say, you go look at what's happening in Australia. Another 10 people, you go look what's happening in Europe. Another 10, you look what's happening in Australia. So we were able to divide and conquer because we had a mass of resources. We have 900 doctors. So therefore we were able to come back with the research and knowledge quickly than an individual dental practitioner would be. So that's the only difference. But the good news is the dental council members are very accomplished people. They're very accomplished dentists because that's how they got there. They were able to provide those guidelines as soon as they were able to find the right information. So I wouldn't say it was delayed at all. I think, I don't think anybody could have done it faster. I mean, we can all, I can look at hindsight and we can always criticize. But reality is that, if I were in their shoes, or I'm not a dentist, but if one of our dentists was in their shoes, I don't think we would have done it faster either. So I don't think there was any delay. Now, second part of your question is that, should the guidelines be revised? I think that's a good question. And I think that it is time for us to look at them. It is time for us to look at them. Recently, as you've seen, medical council guidelines have revised. We have allowed for telemedicine. We have allowed for teleprescriptions. We've made a lot of overhauling changes in the medical side of fields. Unfortunately, dental, we haven't yet made those changes. So I totally agree with you. I think that's a great question. I would certainly like to urge our leaders in the dental council to please take this opportunity to revise those guidelines. And there are many areas where we need to revise. Let me take a couple of examples on that, right? One is that dentistry in the last 10, 15 years has advanced significantly. New technologies have come in, new treatment protocols have come in, new equipments have come in. However, patients are not aware of it. In the world, many people are aware of it, but in India, people are not aware of it. Most people in India do not know that there is no need for you to have a denture. Even if you lose, first of all, you shouldn't lose your teeth. But let's say if you lose your teeth, you don't need to have a denture. You can actually get an implant, which is a small little metal screw that goes in your mouth, and you get a crown on top, and that makes it as good as a permanent tooth. And that takes care of a whole lot of problems that many of our elders are facing in this country, simply because they're not aware that this particular solution exists. Many of our young children and adults do not want to take braces because those metal braces are, they're made fun of. People look at them and say, you're wearing a brace, and so on and so forth. There are clear invisible aligners available. In fact, we have a product that's called Love My Braces. We are introducing it, which is completely clear and clean and invisible. The idea is that you can get new technologies to solve your oral health issues, but people don't know about it. So I think it's important that dental councils either begin to have these knowledge sharing abilities to the mass consumers, or allow the doctors to, within the guidelines, to share some of this knowledge. Because right now the restrictions make it very difficult for dentists to share this knowledge in an open forum. They can share it on a one-on-one basis, but they're not able to share it on a larger basis. So I think there are many changes. Teledentistry, we should be able to offer teledentistry right now. We have launched in the last month and a half a teledentistry service. Now, of course, in dentistry, you cannot solve the problem without actually going into your mouth and fixing it. So teledentistry cannot solve your dental problem. Fair enough. But teledentistry can solve many of your concerns that may avoid your trip to the dentist, may postpone the trip to your dentist, may give you ability to get your oral health done at home before it has gotten worse. So there is a role for teledentistry, and we have introduced that, and we get hundreds of calls weekly basis on that, where patients are calling in, getting advice from our doctors. It is manned by doctors, or it is serviced by doctors, and therefore patients can call and get advice. So I think there is a fair bit of guidelines that need to be looked at, and the dental councils are working on it, I know, but as you know, it is not an easy process. It's a democratic country, trying to get everybody views and inputs and get them aligned. It's not an easy task. I hats off to them for them to try.
Yeah, my question, next question was on teledentistry. You had touched upon it, but I would like to ask you the positive side the pandemics actually taught us. What has it taught us? And you have said that you have procured a lot of equipments, like specific equipments like ASD. So how you going to use it for the future? Like after few months when the pandemic we are bending the curve already. So how it's going to be in used?
Well, many things this crisis is teaching us every day, right? But let me take some examples of it. So, example number one is that the crisis has taught us that safety, hygiene, and sterilization protocols are important. I mean, I don't know before COVID how many people were washing their hands 10 times a day or 5 times a day, right? How many people were, worried about hygiene and safety? People were not thinking about it. So I think the very good news, well, good news in this crisis, as much as one can say, the good news of the positive of the crisis, let's call it that, positive of the crisis, that people across the country and across the world really have been made aware of the need for being hygienic and making sure that they're keeping themselves clean and hygienic. And oral cavity is, if your hands are dirty, you're going to put it in your mouth, you're going to eat your food with it. So I think this is something that everybody, and when you're going to a dentist, it is absolutely important, because dentist is dealing with blood and saliva. It's very important and people are now asking, it's important for people to say, hey, has this chair been cleaned? Has this instrument been cleaned? And people are saying, well, and we say, yes, we have. And they say, well, I don't know if I believe you. We said, all right. We are now deploying AI-based computer vision technology, which will a camera in front of a chair, which is being rolled out as we speak. A camera on the chair is monitoring the chair. And as our assistant is cleaning the chair light goes from yellow to green to say this chair is now fully sterilized. And when a patient walks into our clinic, they can look at and see that this chair, the light says green, means this chair is ready to be used. And as soon, if they want, they can play the video and see when it was cleaned and how it was cleaned. The last video will be available for them to see. And when they sit down on the chair, after 2 minutes, the chair will turn yellow again to say the chair needs to be recleaned. So we are not only our patients are not just accepting our answer, they're asking for proof. And we are deploying technology to give them that confidence and proof. So I think that's the first thing that this crisis has taught us, how to be aware of hygiene and keeping ourselves safe. That's the first thing. The second thing the crisis has taught us, at least for us, is that our assets, at the end of the day, human beings, if we are not healthy, if we are not able to maintain ourselves healthy, nothing matters. Right? I think we all have realized this, that we've been running around in the last decades, running after monetary things or materialistic things. But this has taught us that health is absolutely important. And once health is not there, nothing matters. So that's why our focus on making sure our doctors are safe, making sure our staff is safe, was the right objective. And that is part of our core values. And therefore, we stood true to our core values, and we ensured that our staff was safe. So I think those are the two immediate ones that come to my mind. There are many other crises. How do you culture as an entrepreneur? Maybe for entrepreneurs out there, I would say it is very important to define your core values. Nobody cares about your core values when things are going well, because when things are going well, the core values don't come into picture. But when you are in trouble, that's when your core values come into play. It's only when you're in trouble, you need to say, how do I handle this crisis? How do I do it? And I think we at Clove had defined our core values on day one. And those are trust, respect, and integrity. Those are our three core values: trust, respect, and integrity. And at this time of the crisis, we have proven to ourselves and to our Clovers, our employees, as we call them, that we are standing by our core values. We are respecting our employees. We are trusting our staff. We're trusting our patients, and we are ensuring integrity. So for entrepreneurs out there, I would say this crisis has reminded me as an entrepreneur, as an executive, that the value of core values, it's sort of a rhyme here, but value of core values is very, very important. So Pratibha, those are my three things.
Yeah. So I would like to ask you the final question, maybe like in what is the future of Clove Dental from 350 clinics? How you're going to build it? Yeah, there was a kind of a pause because of the virus. Now, how it would be going in? Because last time when we met, you had said you'll be exploring more of tier two, tier three cities and go penetrating southern part of India. So, what are your plans?
Right. So
Yeah.
today we are, as you mentioned earlier, we started in Delhi, but today we are in 25 cities. We have, over 70, 80 clinics in Bangalore. We have over 50 clinics in Hyderabad. We have another 30 clinics in Chennai. We have clinics in Ahmedabad. We have clinics in Pune. We have clinics in Vijayawada, Kakinada, Chandigarh, Jaipur, Ludhiana, Amritsar. So we have a number of cities that we have already gone in, tier one, tier two, and we'll continue to expand. Our goal is, we were hoping to get to 500 clinics by this time, but I think this 2020 we would have probably added about 100, 120 clinics this year. So I think we'll probably resume new clinic addition probably maybe in January is my guess, because by the time we finish opening this crisis, or maybe certainly in 2021, maybe the first quarter or second quarter of 21. And in the last 3 or 4 years before COVID, we have added 100 clinics. Last 3 years, we've added 100 clinics on average per year to get to 350. And so we intend to go with that growth. India, just to give you some perspective, India's population grows with the size of an Australia every 18 months. So we are adding a whole continent every 18 months in our country. So, and we've been doing it for a while. So clearly the demand for essential healthcare is not going down, right? More and more people are moving to cities. More and more people are, eating food. Well, they were before COVID anyways, but, eating out and eating packaged foods and really sort of, in a lack of better words, using their mouths even more, let's put it this way, and putting things in their mouth that are not necessarily the healthiest. So therefore, oral disease and oral problems will continue to rise. Population is growing, urbanization is growing, income levels are rising. So all of these factors are proof points that the need for dental health and dental care is going to continue to rise. And the good news is India has a good educational system. We have 300 dental colleges, which is about a third of the world. There are about 900 in the world, and India has 1/3 of the dental colleges. We are graduating about 30,000 dentists every year. So the good news is we are producing good quality dentists in this country. The challenge, of course, is dentists don't have the ability to buy the equipment, buy all the chair, the sterilization equipment, the compressors, the UV lights, the cabinets. Those things cost money. And this is where we come in. We are bringing in the infrastructure. We have the buying power. We bring in equipment, high quality equipment at low cost, so that we can provide that environment for our dentists. So this is so the opportunity for Clove is tremendous, and opportunity for dentistry in India is tremendous. And I think we are very excited about it, and we'll continue to grow.
So, my last question would be, what do you want to tell the patients? Like, leave the misconception that, you'll be affected by the virus, how you can approach Clove Dental or, our dentist. But quickly, if you can just tell
Sure.
3 points to the patients.
Sure.
Yeah.
Right. So first of all, I think whether it is Clove Dental or any healthcare facility or any dental clinic for that matter, I think a patient should first, try and get on the phone and talk to the doctor to see what their needs are and see if there is a remedy available, which is why we have a dentistry platform. So we encourage our patients. In fact, every patient who's walking into our clinic has a conversation with a doctor, whether through the teledentistry platform, or our doctor will call them if they've booked an appointment, to at least have a conversation to make sure that they understand what to expect, what to prepare, and how to come, right? So that's the first advice I would give, is have a conversation before you show up to the clinic. For example, if you were coming in for an extraction and you were taking blood thinners because of some underlying health condition, the doctor will tell you, actually stop taking the blood thinners and come back to me in 3 days. And you will say, well, I wish you told me this on the phone. You'd have saved me a trip. I wouldn't have to come. That's the kind of value teledentistry offers. We can offer and prepare the patients to be ready when they come, so that when they're coming in exactly what they need. We make sure we have the right equipment, right doctor, right materials available, so we can give you the treatment one time. You don't have to come back and forth multiple times. So that's the first advice I give you. The second advice I would give you is that please check to see what safety protocols are being followed in that clinic. Do they have the sterilization? Do they follow a 4-step sterilization process, which makes sure the instruments are cleaned, washed, UV cleaned, and then autoclaved in a Class B autoclave, which is a high-powered seam autoclave? These are essential. So make sure that you're checking. If you're there, ask your doctor, how did you clean these instruments? Is your chair clean? How do you ensure safety protocol? Are you changing your PPE? Are you changing your gloves every time? Because a lot of time people would say, I'm wearing a PPE, the gown. But if you're not changing it after every patient, it doesn't really matter. I see in the streets, people are in the restaurant, people are wearing gloves and walking around. I'm like, it doesn't really matter if you're wearing gloves, unless you're changing the glove after every contact. Just wearing gloves and walking around is just a myth. The reality is you have to be able to change those PPE every single time. At Clove, we do that. It's extra cost for us, but we do that. So that's the second advice. Make sure you get a check on safety protocols. And the third thing is, please understand that dentistry is a very, very intricate procedure. There are 7 specialties in dentistry after your bachelor's of dentistry. You have 7 master's degrees that you can take, 7 or 8, 7 of them clinical, which means there is a special master's degree for endodontics, for root canal. There's a specialist for root canals, because root canals, you don't want to go to a person who's not an experienced root canalist, because you can mess up your tooth while you're getting a root canal. There is a separate degree for orthodontia, for people who gives you braces or aligners that I'm talking about earlier. There's a separate degree for people who are looking at your gums, periodontia. There's a separate degree for people who are focusing on children only. There's a separate degree for oral surgery. There's a separate degree for prosthodontist. So there's 7. There's implantology. There are 7 specialists. So dentistry is not one dentist does all your treatment. You have to get treated from the right qualified dentist for that particular problem. And that's one of the advantages of Clove. We have, 70% of our doctors are advanced degree holders. And that's the reason why we have them, because we need to be able to provide that right treatment. So those 3 things I would say, ma'am, for all our patients. Number 1, please call and understand why and what you're going to get done. Number 2, when you're there, please understand the sterilization hygiene protocols in the clinic. And number 3 is, please make sure that you have the right specialist who is treating you when you're at the center.
Yeah, thanks a lot. Thanks for the time, Mr. Singh. It was nice talking to you and getting your viewpoints. Hope we all, come out of this pandemic as soon as possible. And
I hope so too. And thank you so much for having me. And I apologize. I'm a very passionate guy. I'm passionate about dentistry and passionate about clothes. So I apologize. I tend to be very passionate. So pardon me. Right?
so
Thank you
thank
so
you.
much. Thank you very much.